Hi, my name is Karis Hall, and this is my pilot project study that's going to discuss utilizing passive leg raising for the septic patient. Hypotension is one of the initial clinical presentations of shock and requires effective and timely treatment. A majority of patients in progressive and intensive care units live with comorbidities that induce concern for fluid overload. Clinically, one of the primary treatments for hypotension is a fluid bolus. However, sometimes one fluid bolus does not increase the patient's blood pressure enough, and then too much administered fluid can result in correction with diuretics and the need for vasopressors. Careful consideration to patients with concern for fluid overload should be assessed. So this pilot project study is going to compare the administration of fluid boluses versus performance of passive leg raising or PLR exercises. Blood pressure will be the means of measurement to determine the efficacy of the control and comparison interventions. The PICO question that's guiding this pilot project study is, what is the effect of performing PLR exercises in hospitalized patients at risk for or diagnosed with sepsis in comparison to administering a fluid bolus on the increase in and sustainability of blood pressure? So the articles that I searched and synthesized were published between the years of 2008 and 2018, and they were written in the English language performed in Western countries. The research participants for all of these articles were 18 years or older, and they were clinically diagnosed with any form of sepsis during their hospitalization. I then used the Johns Hopkins Research Appraisal Tool to determine the applicability of the articles to the defined PICO question, and then considered the level of evidence and significance of research conclusions and limitations. And then in the PowerPoint that I'm attaching with this video, I also included the literature search terms that helped me find the articles that I used for this research. So what is known and unknown as it relates to the PICO question? Right now, in current nursing practice, we know that fluid bolus administration is the gold standard. It's evidence-based, and it does treat that hypotension for the septic patient. Various interventions have been researched to discuss other treatments for hypotension in septic patients. A lot of the articles that I read discussed invasive and non-invasive hemodynamic monitoring, fluid responsiveness, lab values, etc. What we still don't know is if PLR is truly an accurate measurement of fluid responsiveness and what the relationship is between PLR and hemodynamics. Another question is, would PLR work best in combination with or in substitution of fluid boluses? So this study proposal is going to help determine the efficacy of PLR in comparison to fluid bolus interventions for hypotension in septic patients. We're going to focus on blood pressure measurements. It is important to note that if the physicians need information regarding hemodynamics or lab values because of patient safety, then those interventions will be able to still be conducted despite the patient's participation in the pilot study. It's just not going to, it will be considered as we analyze the data, but it's not going to be what we're specifically measuring for this pilot study. This pilot project also matters because it's going to help give us a clearer understanding of how PLR impacts the body's response to hypotension, and give us some additional options for treatment, hopefully, of that hypotension. PLR is also within the nursing scope of practice, so this is something that nurses can perform without a physician order. This pilot project study is going to be a quasi-experimental design that will be composed of 70 participants, 35 in each group. So the control intervention is going to be a 1 liter normal saline bolus that's going to run at 999 milliliters per hour. Again, this is currently the gold standard, and in this specific study, we're going to measure the blood pressure every 10 minutes. The comparison intervention is going to be the PLR exercise. So the patient is going to be in a 20-degree Trendelenburg position for 10 minutes. During this time, we will be performing those PLR exercises. Then for 5 minutes, the patient will be allowed to rest in a supine position. We'll perform this 3 times, and we'll measure the blood pressure after each PLR increment intervention and then after the final rest period. All the participants for this pilot project study will need to be 18 years or older and again have that current diagnosis or high risk for developing sepsis or septic shock, any form. We will provide a consent form for the patient or their DPOA or legal guardian to sign if they would like to participate in this study. It is important to note that hypotension can be caused by various reasons. And so if for any reason if the patient is experiencing hypotension and we're unsure of the etiology or cause of that, then data can go on ahead and be collected and these interventions can be applied. But if it turns out that the patient is hypotension for any reason other than sepsis, then we'll need to stop collecting data. In this consent form that they will sign, there will be information from the Institutional Review Board. IRB will need to perform a full board review for patient protection since we are implementing an intervention that is not currently evidence-based. Physicians will also need to deem patients medically stable enough for participation. And again, because patient safety is our primary concern, if at any time during data collection the physician is concerned for patient safety and other interventions are necessary, then the patient could potentially be excluded from this study because the other interventions could potentially change the outcomes that we're measuring. Regardless of whether participants are able to fully complete this intervention or not, the MRN of all participants will be collected because we want to understand our limitations, what we need to change for the bigger research project that can be conducted later. And then we also need to have access to all those lab values, hemodynamics and blood pressure readings, etc. I also want to point out too that if a patient does have contraindications to PLR, then they will be assigned to the group that will receive the 1 liter fluid bolus. All other participants will be randomly assigned to either the control group or comparison group. We just want to make sure that we have as many patients fully able to complete this intervention as quickly as possible. And then lastly, the theoretical and conceptual definitions of outcomes include how to most efficiently and safely evaluate and treat hypotension in the septic patient population. The operational definition is the blood pressure findings based upon the intervention provided. So that would be either the fluid bolus or the passive leg raising. So thank you. This is my pilot project study regarding utilizing passive leg raising for the septic patient population. Thanks.